Everyone, welcome to my YouTube channel. My name is Zeti at Nashville. I am a clinical officer and with more than 16 years of working experience in the medical field, and I have worked in very many capacities in public hospitals, in non-governmental hospitals, in and out of the country, and that is Kenya. And I am so glad that you're joining me in my YouTube channel. I do videos to do with healthcare. I do videos to do with vaccination, travel medicine, basically anything that you want to ask about medical care that I am able to answer, or I can refer to someone or dig up the information for you. I'll gladly do that. All right, welcome my new subscribers. Thank you very much, and I am very pleased that you guys have really done me well. This is my 4th video and I can see the viewership is going up. I really want to appreciate that, and it's encouraging actually, and it makes me wake up early to look up for things that you people have been asking. I have been planning to do videos weekly, twice a week, but there are many questions that have come up from my last video that I did about the effects of COVID vaccine, the side effects of COVID vaccine. And I just thought I should just come up and clarify 1 or 2 things, because most of the questions that were being asked were out of the scope of what I had covered. That is the common side effects that people experience, but people apparently experienced far more effect from the COVID vaccine that they received. And I just wanted to come up and just clarify 1 or 2 things, or reassure, or just firm up on what we had discussed. And I'll be checking on the side on my notebook and also on my laptop for the footnotes that I put under the comments, so that I don't miss out on any of the serious query that had come up, because I had to investigate. I had to call up some of the epidemiologists. I had to call up virologists, so that we can get clear and we know that we are on the right track, so that I'm sure of what I'm telling you. Okay, so when you're here, be assured that the information you're getting is legit, and yes, it's not a cook up or anything. All right, okay, I'll jump straight into the topic of today, and that is basically clarifying on more of the side effects that were inquired about. And our first, mostly, let me just be general, that most of the effects that people experience that are out of my scope of coverage last time was mostly sexual health and reproductive health. Basically, that is where the question came from, and we'll just cover here and there just to make sure that we understand. Okay. So the first question was that, thank you, that was from Ilka. She said that thank you very much for the video, and it has demystified a lot of things that I had issues about. However, I did not experience either of what you covered, but I had an issue with my menstrual cycle. I had heavy menses, and it prolonged. Okay. So when I checked up on the CDC and on the vaccination hub, what was discussed is that yes, many complaints have come up, especially for AstraZeneca, and we have Dr. Kathleen and Dr. Z, who are from American College of Obstetrician and Gynecologists, who have been following up and doing research on the same. And basically, they came up with many of people who had complained of the same in America and also in the UK. But on contacting the vaccine center, that is Pfizer, basically, when you talk about menstrual cycle, it is a complex hormonal process. Okay, so and it varies month to month, season to season. Even yourself, if your diet and how your body state is, your menstrual cycle can vary. So it is something that really they cannot observe, and it's not measurable. Okay, it's not a measurable indices in research, so it is very hard for them to follow up and find out if the vaccine is the one that is causing that. However, the issue is that I'll just say it across, the benefit outweighs the risk, okay? And I'm not discrediting or dismissing what people are feeling about, experiencing about their menstrual cycle. But the thing is, I just want to clarify that the effect will be transient. Transient, I mean they'll be short-lived. They're not going to go over and above like more than 3 or 4 months. They're saying that you might experience such in only like 1 or 2 months of your cycle, and then it will fall back to the normal of to normalcy. And the other thing that I found out was, according to Dr. Kathleen Edwards, a professor at Vanderbilt University Medical School. She's a board of directors in the monitoring team of Pfizer team, and that is she's also a gynecologist, and she's the one who advised on maybe the cycle that someone can have, and also the thrombocytopenia, the thrombosis issues. Okay, so it's thrombosis with thrombocytopenia syndrome. Okay, thrombocytopenia syndrome is where you have low platelet levels, and if you have low platelet level, you have a tendency of bleeding for long. And if you bleed for long, it means that definitely any place that you're cut, any place that is bleeding, that is when you shed off your uterus during your menstrual cycle, you will bleed for long and heavier menses. All right. So, and these symptoms are short-lived. Those are transient symptoms. They are short-lived. They can go on for 1 cycle or 2 cycles. And it is not something that was neglected, but it was reported, but it's not measurable. So in a research, the indices have to be measurable, and they have to be continuous. And these are things that they were not able to hold touch with. But research is still going on about the vaccine, and most likely something will come up. Okay, Milka, I hope I have been able to answer your query. I'll go to question number 2, which was from Dr. Isaiah. Dr. Isaiah was concerned that he's going to get a COVID shot, and he was concerned about the people have been talking about libido, reduced libido, and he was a bit concerned. He checked up, and I found, yes, there is transient libido, low libido cases that have been reported after the vaccination, but this is basically due to the constitutional signs that the symptoms that people exhibit during the COVID vaccine. That is the fever, the muscle ache, and then the fatigue. Okay, so if you have fatigue, definitely your libido will go low. If you have fevers, your libido will go low. All those things affect your libido. So most likely it is just as a side effect because of those side effects that you're having this side effect, but it directly does not, the vaccine itself directly does not affect your libido directly, but indirectly from the other constitutional signs that you get, the fever and the fatigue and the muscle ache, they can affect your libido per se. However, if you don't get the vaccine and then you get the COVID itself, COVID has been reported to cause issues to do with erectile dysfunction. So you can get erectile dysfunction, and it's because of the effect of the COVID on your blood vessels, because we know erection is from the blood vessels, and if when blood flows to the corpus cavernosa, and then it causes an erection. So if the blood vessels are not functioning well, and your heart is not functioning well, definitely you'll come up with issues to do with ED. Okay, so you are better off having a transient libido, low libido, other than having a prolonged being a prolonged case of erectile dysfunction. Okay, I hope Daktari, I have answered your query. So I think you should not get worried getting the vaccination, because it's transient, other than getting the infection itself, which will cause ED, which is a long-term complication. Okay, so the question number 3 was from Marion, and Marion was worried that she's planning to conceive, and she heard that the COVID vaccine causes infertility. Male. That is not true. That one is up. That is outrightly a lie. Okay, and I will just link up a leaflet written by the Gynecological Society of Kenya, which has given an okay that COVID vaccine does not, and any vaccine does not. Most of the vaccines that have been approved, there is no vaccine that is known to cause issues of infertility. So you should not get worried about infertility. Okay, so just go ahead and get your shot. Pre-conception, it is safe. After conception, it is safe. During breastfeeding, it is safe. Okay, I will link up a journal that will be able to support what I am saying. All right. Okay, so the other thing is about Marion is planning to have an IVF treatment, and she's worried about the vaccine, that the IVF will not take up. Okay, so now if you're considering to have IVF, which is the treatment of IVF, I don't think it has any effect with IVF, which is almost the same as the preconception period. So I don't think it will have any effect, and you can consult your IVF specialist, your fertility specialist, and I'm sure he'll be in a better position to advise depending on other indices about your body. He'll be able to advise. Okay, because they will obviously check most of your things, most of your vital signs. They'll do a blood check for you, they'll do your scans, and they'll be able to advise. But a vaccine per se cannot be a thing to delay your procedure. Okay, so just consult your fertility specialist, and I'm sure he'll be in a position to answer you better. But I don't think it affects anything to do with the fertility treatment. Okay, another question is about miscarriage. Okay, so someone had a miscarriage after she had a COVID vaccine. Okay, the only thing that is worrying is because of the fevers. Okay, so most of the time during the first trimester, it is a very critical period of pregnancy, and fevers, even from malaria, fevers from any protozoal infection, fevers from a UTI can cause a miscarriage. Okay, so if you are worried about getting a fever, which might be the cause of a miscarriage, but it is still advisable for you to have the vaccine, because if you end up getting the disease itself, it will be worse. Okay, so if you think you can be very safe, you are at home alone, and either the people you are with are taking care of themselves, they're not sure you can take care of yourself, and you're sure you will not get the infection, then I can advise that if you're worried about the fever and you think it can be so much of a trouble, you can take your vaccine in the second trimester. But do not delay the vaccine because of worry of fever. Because fever, you can still take medication to reduce the fever, the temperatures, and there's no account that it has been reported that fever was not able to be reduced because someone took the vaccine. You can take phenol, you can take paracetamol, which will be able to reduce your fevers, not unless all the analgesics, antipyretics have been contraindicated, which I don't know what condition that will be, but you can take antipyretic, which is fever reducing medication, to reduce the fever. So do not hesitate to take your vaccine because you're worried about the side effects. Okay, you just be prepared. Talk to your gyna, talk to your obstetrician. He or she will be able to advise you. If you're going for the vaccine, he'll advise you what medication you need to arm yourself with. Okay, and you might end up not even having the symptoms, so you should not be worried of the unknown. Okay, so I'll still advise take the vaccine, whether in the first trimester, whether you're planning to have a pregnancy, or whether it's in the mid or late trimester. So just take your vaccine because it protects you. The effect of the disease itself is more than the disease itself can cause a miscarriage because of the symptoms that you will have. You'll have vomiting, you'll have the fever itself for 3 weeks. Okay, So you'd rather take the vaccine and have a fever for 1 day, which you will manage with paracetamol, other than having a fever that you are not able to manage for 3 weeks because of the disease, and then you end up having the miscarriage that we are worried about. So I wish you a safe pregnancy, and please don't hesitate to take your vaccine. Okay. And the last question is about eligibility. Okay, who is eligible to get the vaccine? Okay, the vaccine can be given from 12 years and upwards. So even children of 12 years, if you are able to access the vaccine for them, they're eligible for vaccine from 12 years upwards too. So from 12 years upward, they can take the vaccine at the normal doses, at the normal ranges. Okay. All right. I hope I have answered our few questions, and thank you so much for listening in, and thank you so much for viewing. And please keep on subscribing, keep on sharing, keep on just watching my videos, and let's keep the viewership up, and let's grow this channel together. Bye.